Yesterday, we talked about how to get involved in research, and today we're talking about how we go from research to real life. How do people learn about what researchers are up to, and how does research actually get used? We notice when a new vaccine or medication becomes available, but it takes a lot of work to get to that point. And what about research that happens outside of a lab? Let's talk about it. If you don't know me, hi, I'm Nadia. I talk about public health and pop culture. It's day 3 of National Public Health Week, and it's day 2 of us talking about scientific advancement. Let me know in the comments if you've been enjoying this week's video so far, and without further ado, let's get started. Okay, so how does research get shared and how does it get used? Obviously, research is presented in journals and in conferences, but not everyone's reading journals or going to conferences. Sometimes researchers give short summaries of their work on their websites or on social media. Others might talk to news outlets about what they found and what might come next. And obviously, of course, the new thing is people starting blogs or newsletters. And the way that researchers talk about their work changes depending on who their audience is. Like if you're talking to a legislator. When I was in my master's program, we did mock congressional hearing testimonies where we had to talk about research. We had to give a short summary of the research study that we were assigned and then be able to answer questions about it. Basically, our guidelines were don't talk too long and don't get too complicated because you don't have a lot of time. It's probably similar at the state level too. Even going back to the news example, the way you talk about something on camera might be a little different from if you're talking to a newspaper. But basically, the way I thought about it in class was what did we find in what population and why is that important? The minor details of your research methods probably don't matter to most people, but you should mention the things that, without that context, their understanding would be completely wrong. Usually for congressional hearings or meetings, you do have to be invited, but for news outlets, you might be asked for an interview or you can ask the news outlet to do an article about your research, but it's not guaranteed. You could also pitch an opinion article if that's up your alley, and in that scenario, you basically say, we found out this, so we think this should happen. You're making an argument. Lawmakers and journalists aren't the only people you can share your research with. Earlier this week, I mentioned you could respond to proposed policies from the Department of Health and Human Services and other federal agencies through comment periods, and people often share their research in public comment letters. Now, kind of pivoting into how research is used, so there's policy changes, of course. Research is cited in the Federal Register, the Congressional Record, other similar places. They're used to justify certain policies being implemented. Beyond policy, research is often cited in lawsuits, and that also includes news articles that talk about research, like the New York Times has been cited in a lot of legal cases, and that has a huge impact in both individual cases and also sometimes broader implications. And then when it comes to clinical research, in the US, there are usually different layers of approval or review before a medication or a clinical guideline gets approved. Like when it comes to cancer screenings and preventative services, those guidelines are shaped by the U.S. Preventive Services Task Force, and those guidelines are based on studies suggesting there's a benefit for screening at X age or whatever, and there's no benefit or change in illness at this age. Like, that's how that works. Also, major professional societies will make recommendations as well. The American College of Obstetricians and Gynecologists put out updated guidelines on endometriosis, I believe, and that was based on research on how the condition works. And things like that are what shape what happens in doctors' offices and hospitals. And then for drugs, they usually have to go through FDA committees first. But like I mentioned before, there's usually a lot of steps leading up to being able to even make a drug. Like before you test it on people, you have to know if your molecules bind to the right receptor, or whatever your drug is like. There's biologics and there's small molecule. There's a lot going on there. But basically, you have to see what the science of the drug functions like first. And so the earlier stage research, you have to be able to justify that too. And so basically, that goes back to communication. So first you want to think about who your audience is, where they get their information, how much time they might have to listen to you, or how quickly you might have to grab their attention. And then you'll think about what's most important to share about your research or about your study, and you'll want to put that up front, essentially. And then you'll want to explain not only what you did, but also why it's important. I hope this was helpful in thinking about how research is shared and how it's used. Thank you all for watching, and I will see you all tomorrow.